Hello, everyone, and welcome to What's Your Everest? My name is Liam Hubbard, and I'm a senior at Northwestern University studying human development and journalism. I'm co hosting today's show with Dr. Carla Steingraber.
Hi, everybody. I'm Dr. Carla Steingraber. I'm a licensed clinical sport and performance psychologist, certified in mental game coaching, and the author of two books, including Growth Mindset for Teens and What's Your Everest. Both are available on Amazon. I practice at Everest Strong Coaching in Northbrook and have been developing a multidisciplinary team, and I work with clients both in person and virtually. Today, we're super excited to welcome Dr. Ann Guernon. Dr. Guernon is an associate professor of speech language pathology at Lewis University and is the interim associate dean of the College of Nursing and Health Sciences.
Dr. Guernon is also a clinician and provides services to individuals with communication and swallowing disorders. And in addition to her work in this area, she is an expert in traumatic brain injuries and specifically does research on athletes.
Dr. Guernon, this is a subject that is very interesting to me because I did my postdoc in neuropsychology. And it was interesting how little was known and understood about the seriousness of concussions, even small ones, especially over time. And certainly in my work, I've seen many a person who just thought they were bad at school. And with a little bit of a screening, I was like, oh, we better go get you a neuropsych to find out what's really going on. So I would love to hear from you where things are at and hear more about your professional journey into speech language pathology and what led you to Lewis University. So it's a big question.
Sure, that is a big question. Let's see. Well, first of all, thanks for having me on. So my journey in speech language pathology really started. I knew that I was interested in a helping profession, right? I always had a medical, interest in the medical field, and happened upon SLP in undergrad, and then really grew to love acute care, inpatient rehab. And so my experience, all of my clinical experience really has been rooted around neurological communication disorders and primarily traumatic brain injury and stroke. I spent some of my career at RIC, now Shirley Ryan Ability Lab, and, really found my passion there with traumatic brain injury, and then was lucky enough to be exposed to the clinical trial side of things, looking at developing treatments for traumatic brain injury. And then the how I happened upon concussion is that my kids, as they were growing up,
Oh,
started to be
wow.
more active and right
Yeah.
in more competitive soccer teams, and what I was seeing on the sidelines of the games that I was going to wasn't really jiving with what I knew about prevention and management of traumatic brain injury. And so really that led me to my dissertation when I was getting my PhD to really understand how we can better support coaches, especially those coaches that are volunteering, coaching their son or daughter's little league team and don't really have a background in anything medical. How can we support them to recognize, signs and symptoms of concussion in a way that isn't requiring a lot of effort on their part, but that they can understand the seriousness of it and the importance of pulling a child off the field if it's warranted.
Yeah, it's so important because a lot of there sometimes is this attitude like shake it off, just get back in there. And certainly the older the kids get, the more motivated they are to play and have every opportunity. So that's a it's a tricky space. Within speech and language pathology, where do your primary clinical and research interests lie?
My research really kind of spans the whole continuum of traumatic brain injury. So I do some work in understanding how we measure and also support care providers when they're caring for people who are in a disordered state of consciousness after brain injury, and then to the whole other end of the spectrum, right, with prevention of mild traumatic brain injury and concussion and supporting those decision makers as well.
Mhm.
So,
And can you tell us what was your motivation behind co-authoring your recent article on concussion recognition for parents and coaches?
sure, absolutely. So, I work with a group of colleagues through the American Congress of Rehabilitation Medicine. We are involved in the Athlete Development and Sports Rehab Networking Group, so a group of um, clinicians, researchers who are interested in sports development. And then we also partnered with the Mild TBI Task Force in that, and felt that it was really important to take some of the information that is coming out of the International Concussion and Sport Group, who they typically meet every 4 years and come up with new guidelines and recommendations for the management of sport-related concussion. But they're typically, that information is published in journals and pretty dense. And so we wanted to create a short document that would be accessible to coaches and parents, that really just gives them the information that they need and the language that they need it, so that it's easier to digest and gets into their hands really.
That's so valuable. That's really valuable because so many of us, we haven't been exposed to it, so we don't really know. What are some of those most common signs and symptoms of concussion?
Right. I think it's tricky, right? Because a lot of the symptoms are invisible to us as we're observing, right? So if the player doesn't have the awareness either to tell you that they feel dizzy or that they have a headache or they just don't feel right, that's, it's easy for us to miss unless they're stumbling around on the field or they're having, issues with their memory. So I think that those signs are really sometimes hard for people to recognize. And then I think also, that attitude that you alluded to, that we can just shake it off, right? And that's the way we used to think about these things, right? You just play through it. You'll be okay. It's not a big deal. So I think that those are things that um, make it easier for us to miss some of the more subtle signs of concussion.
Yeah, and it's an interesting thing too because one small concussion, at this point in time, you can totally get through it. And when there's another one in a while later, that's fine. But certainly there's some sports where, such as football or boxing, where there may not be any recovery time in between these concussions or these insults to the brain. And I think people don't really realize how important it is for the brain to be able to recover.
Hi, everyone. What's your Everest? We all have a mountain we're trying to climb. My book here, What's Your Everest? How to Win in Sports, Career, and Life While Enjoying the Ascent, is here to help you with your journey to the top while enjoying the climb. It's written for both teens and adults who are looking to grow, push themselves, and believe bigger. It's available on Amazon. And if you find this book is helpful to you, even with one step up the mountain, I'd truly be grateful for your review. Keep climbing. You've got this.
To heal. Yeah, no, I think
Yeah.
that's so true. And I think that that's maybe where there needs to be more awareness built in, because especially if you're a middle school, high school athlete, you want to get back to the game, right? And as a parent, you want to see your kids get back. And so it's easy to try to let them go back maybe earlier than they should, right? And we know that if they recover from that concussion and they take the time to do that, that's better, right? Than if they go back too early and then they get injured again. And I think that that's not always appreciated.
Yeah.
as much. We know that the sooner that we recognize concussion and remove the player from the game and let them start to recover, the better outcomes they have, right? The quicker they typically recover. And the idea that we're reducing the possibility of them sustaining a more serious injury before, while the brain is a little bit more fragile, if you will, right, or more susceptible to another injury.
And what are some of the misconceptions about concussion recovery in youth sports?
Well, I think um, like I said before, I not everyone wants to believe that they need to wait until their symptoms have subsided before they get back into play, right? So there's feeling better, but they might still have a headache on and off, or they might still be sensitive to light, but they feel better than they did, so they want to get back into the game. So I think that is one misconception. I think also the idea that that a concussion isn't a traumatic brain injury, right? Because we don't use the word traumatic brain injury all the time, right? I think
Hmm.
people have this idea that it's a milder injury, which it can be if we allow someone to recover and identify it, but it also can lead to more serious complications if we don't pay attention to it. So I think those are probably the two biggest misconceptions.
Yeah, certainly concussion doesn't sound the same as brain injury, right?
Right.
Yeah. We don't like the sound of that, but it is, right?
Yeah.
That's interesting. What about proper concussion management from a multidisciplinary perspective? What does that really look like?
Sure. So I'm a firm believer in multidisciplinary practice, right? And I think that we can start that multidisciplinary practice on the field by making sure that our coaches and parents are educated about the signs and symptoms. Depending on the severity of the concussion or the symptoms and the length of time it's taking to recover from that, I think it's really important to really make sure that that person is referred to the team of people that they need to be, right. And I think the medical management of concussion has really um, you know, gelled in the last 10 years, where I think we know that it needs to be a multidisciplinary approach, right? And that we need physical therapists and speech language pathologists and other specialists involved.
And for any coaches who might be listening to this episode right now, how can coaches practically create safer sport environments when it comes to head injuries?
Yeah, that's a great question. So, we're never going to completely eliminate the risk of a concussion, right? But I do think that it's important for coaches to be educated enough to know how to recognize signs and symptoms. And I also think it's really important that we make sure coaches understand that we're not expecting them to diagnose a concussion. We
Mm.
really just want them to recognize that something's off, right? Something's not quite right with this player, and we should remove them from the game and, see how they do, see how things go, refer them to a medical professional if that's needed. And then I think also building a culture on a team where the players know that that it's important for them to report any symptoms that they're experiencing after a hit or a fall, or anything that happens, and that it's okay to report if their friends are not feeling well, because I think there's a lot of evidence to show that team members are more likely to report that their teammate isn't acting the way they normally are over someone fessing up, right, that they don't feel good, right, because no, they don't want to leave the
Right.
game. So
So one thing that I know people might not know a lot about or anticipate is how a concussion at one point in life, maybe even prior to a child being in school or early on before school is very demanding, could later impact the child in terms of their ability to do math, and we might just chalk it up to, oh, this person isn't very good at math. Any tips you can give to parents who, might have misunderstood or not properly thought that a head injury was a head injury?
Oh, yeah, that's a really good question. Maybe a referral to a speech language pathologist or other healthcare professional that could provide strategies and, some therapy for that is, not a bad idea. And that those things could be caused by the earlier injury, not that they just can't do math or that they
Right,
just
right,
can't pay attention. Yeah.
right. Yeah. And from your perspective, what about social emotional learning? Why is it important for youth development?
Right. Why is social emotional learning important for youth
Yeah.
development?
Sort of a buzzword these days. And I know the
Yes.
schools are implementing curricula with this. It's not always very adequate, in my opinion, but I'm curious. As
Well,
a
sure. I
psychologist, I'm
mean,
dying to know the answer.
yeah, social emotional learning, right? I mean, we need it to get we need those skills to get through every day as as adults. And so I think, that those building blocks of being able to regulate yourself, being able to prioritize and do all the things that we do as humans, I think that that is essential. And I do think that participating in sport is really important for that development, right? Because you learn a lot from being on a team and, working with your teammates and listening to your coach and learning how to win and lose and right, you dealing with disappointments and
That makes sense. And then how can coaches intentionally teach social emotional learning rather than just kind of assuming it develops automatically?
that is a great question that I feel like you might be able to answer better than me. But I think, um, you know, I was thinking about this a little bit before we came on, and I was especially thinking about it from, the perspective of a lot of the coaches that I work with and interview are volunteer youth coaches, right? And so, how do we teach them, like give them some pearls that they can use when they're coaching, right? That again, if we expect them to do concussion training and they need to do some training to be just with the sport that they're coaching. So I think that somehow being able to incorporate that into their everyday routine as a coach and giving them some some information to use is really important. And I honestly am not quite sure what that looks like what the best way is to disseminate that. And I think we're struggling with that a little bit with the recognition of concussion and how do you train coaches to recognize those things and make those trainings meaningful and something that people are actually going to do.
Yeah, there's a lot of learning that comes out of sport. There's so much potential there. Liam is part of an intern group, and we've actually developed a pilot project with a travel basketball team where we were disseminating lessons each week to the coaches on different areas of sports psychology. And as you know, sports psychology came out of psychology. So,
Yeah.
emotional regulation, frustration tolerance, uh, mindfulness, breathing exercises, the difference between anxiety and excitement, and how you can harness each, etc. So there are a variety of topics, and we can teach our athletes how to regulate a little bit better, or that there are tools right there for them to use, or
Sure.
maybe the coaches can remind them to use it. Maybe there would be a little bit if there would be a little bit more of this social emotional because you'd notice, oh, I'm anxious. Maybe my teammate is, or maybe the other team is anxious as well. Just being
Yes.
aware. So that was our intention. So we'll see what the results are.
Yeah, that's great. I love that.
Switching gears a little bit, certainly I used to work in nursing homes, so I saw lots of people with swallowing disorders, usually post stroke, or some kind of medical issue like that. What other kinds of swallowing disorders do you work on or work with people on?
Yeah, so I don't necessarily work clinically anymore with people with swallowing disorders, but we, as a field in speech language pathology, we can see people with swallowing disorders related to Parkinson's disease, brain injury, certainly, other types of neurological diseases, progressive diseases. Um, Head and neck cancer is another area,
Mm,
as SLPs that we can see people for swallowing issues. So again, there's a wide array. We also um, we have SLPs that work in the NICU on feeding and swallowing with premature babies, and pediatric feeding and swallowing disorders as well. So we really span the whole, um, from newborn to
yeah.
elderly. We span that whole continuum. Yeah.
Is that the same with communication disorders? I mean, obviously, the newborns are not communicating exactly like that, but
Sure, but in some ways they are, right? I mean, they are,
yeah,
they just aren't, yeah, saying words.
yeah.
Absolutely. We have clinicians who work in early intervention and go into the homes of families with young kids who need speech therapy, and then as the nursing homes and people who are recovering from stroke or have dementia, any of those things we can address in speech therapy. So we tend to have, when we have students come into our grad programs, they typically are either they want to work in the schools and with kids, or they want to work in the hospital with adults, right? And then there's always some in the middle that want to do it all. So
Yeah. Well, one thing, there's a common misconception, I think, at least when I bring up speech therapy to clients that I see, they think it's just about learning how to speak better, and they don't realize how broad of a field it really is. And I don't know what it looks
yes.
like today, but we used to use it frequently for people post brain injury who had to work on being able to tune in and tune out background noise.
Yes, absolutely. Yeah, I think, again, the name of our discipline doesn't do us justice, right? Because it doesn't cover all of the things that we do, but absolutely we work with people with traumatic brain injuries that have attention, memory, executive functioning issues. We work with people who need to use augmentative and alternative communication devices, right? And so it's not all just about speech. Then you put the swallowing aspects into that. So it really is a broad field, and it's a great field to go into, right? There's so many different possibilities, much like psychology, right? There's so many different things that you can branch out and do. So.
In your clinical experience, I'm really curious, what would you say was and has been most rewarding and what has been most challenging for you?
So I would say that the most rewarding thing for me was always working with a patient and their family and seeing them um, accomplish whatever goal it was that they had, right? And being able to, when I worked in inpatient rehab, for them to be able to go home after something, when they first started talking again, or they were able to eat for the first time after having an
Mm,
injury. I mean, obviously those are really rewarding moments, right? To feel like you've had an impact on that, and just to see that person getting to do, the thing that they want to be able to do again. I think the challenging part of it is maybe, working within the healthcare system that we have, and not being
Yeah.
able to provide the services in the way that maybe feels like it would be most successful, but you're challenged with the constraints of the requirements of insurance, and the organization that you're working within, and all of those things. I think that is probably the most challenging part. Um,
I've often wondered that because in the nursing homes, very often, someone might be rehabbing from an injury, they plateau, services get cut. And, in life, plateaus are just a point in time before there's improvement. But of course, once you stop with whatever therapy, sometimes you see a pretty significant decline. So the therapy was doing something, and not everybody is able to do the exercises on their own.
Yeah, we talk about that a lot in my classes because, there's this, and it's changing, but there is that kind of the thought that, um, progress kind of ends after about a year after a stroke or a brain injury. And we have evidence to show that that's not true, right? That people can make gains after an injury for many, many years. The challenge is that those gains sometimes aren't in the increments um, that a therapist is able to document in a way that would continue the reimbursement for those services. And so, I think that, requires us to, um, advocate obviously for changes in the healthcare system, but also to be more creative about how we document change, and, really what we're working with our patients, to get to the next step, being able to do that in a way that is meaningful, and that we can write that in our documentation in a way that warrants more therapy. Because, yeah, I, um, honestly, I hate that word plateau because it's so, it just, it sometimes, I think it makes people feel like they're never going to make any changes again. And like you said, that's not the case, right? It
Mhm.
really, we all hit a plateau of some sort sometimes, right? And then we just keep working. We keep working towards it. We sometimes get over that hump, but
Right. Well, there are
yeah.
some remarkable things where people believe something's not possible, but it is. Like I said, when I worked in nursing homes, I also worked in Alzheimer's wings. And after some time, some of the patients I would visit would be like, "Oh, is it Wednesday already?" And I was like, "How'd you know it was Wednesday?" They said, "Well, you always come on Wednesday." So they started to remember, and it's underestimated how important emotion is in the building of
Yes.
memories. Any strong emotion, that
Yes.
memory will be uh, stronger, or yeah, more lasting. So if an Alzheimer's patient can start to remember that it's Wednesday because I showed up, that
Right.
tells you a lot. Or I saw it with a Korsakoff's patient, and for people who don't know what that is, that's a dementia where you don't build new memories because of how severe the alcohol abuse was. And I've seen them build memories where they're suddenly talking about the group therapy from the other week because something really was memorable to them. So
Yes.
the brain is incredible.
It is incredible. It really is. Yeah. And I feel like we're just, at the tip of the iceberg, really. We've the what we've learned over the last 15 years, and the changes in technology, and, and imaging, and things is incredible, but I feel like there's still so much that we don't know about recovery and change, positive changes to the brain.
Yeah. What would you say to someone aspiring to enter the field you're in, either from the research or the clinical side of things?
Yeah.
Oh, well, I would say, again, speech language pathology is an incredible field. And when you start, you kind of have blinders to, I'm going to be a clinician, right? I'm going to work in a school, or I'm going to work in a hospital, or something like that. And you really don't realize that there's so much more available. If someone would have told me 25 years ago that I would have, worked in several different medical settings, then I would have worked in clinical research, and then I would have been a professor. I don't think I would have believed them that that was, the path that my career could go. So I think that um, it's always important to realize that there's so many more opportunities, often with any kind of profession, but that there really are. And I think the other thing that's wonderful about speech language pathology is that it's flexible. So if you're at a point in your life where you don't want to work full time, or you're not ready to, um, advance your career, you don't have to do that, right? There are opportunities to stay in the field, and not work full time, and still stay connected. And I think that that's, a nice aspect of that as well.
Yeah. Well, tell us a little bit, what's next on the horizon for you? What's your Everest?
Oh, my Everest. Let's see. So, what is my Everest? I would say, um, since COVID, and also starting, working at the university level, I have not had as much time to do the things that I really love to do. And so, in my um, earlier life, I was a runner. I ran quite a few half marathons and one marathon.
Oh,
And so
nice.
I would really like to get back to that. So I've started running again. And my goal is to run a half marathon this fall. So,
Nice.
so
Fantastic.
a
Yeah.
little Everest, but it's, yeah,
Well,
getting me back
big
there.
enough, right? Big enough. It's
Yeah.
still 13 miles. Yeah.
Yep. Right.
Yeah. Well, wonderful. Well, thank you so much for joining us today. It was a real pleasure to learn more about speech and language pathology and the clinical side, the research side. It was really, and how it
Sure.
impacts youth sports. It's fantastic.
Yeah, absolutely. Well, thank you again for having me. It was fun.
Yeah, thank you so much, Dr. Guernon. We really appreciate your time.
All right. Thank you.